describe a pharmacist-physician collaborative practice agreement?
Agreement?
A collaborative agreement. Can you kind of expand on that a little bit? I'm not sure.
It's a tough one. That's a mouthful.
I would describe a pharmacist-physician collaborative practice agreement as a document, an agreement delineating how a pharmacist and physician would function together. So it would allow the physician-pharmacist to know their roles at the health center, and it would also allow them to complement each other in a way that's very clear, as opposed to the physician asking the pharmacist if they can do something, or the pharmacist asking the physician if they can do X.
So I think as long as there's an agreement about what's the scope of practice, then it's truly collaborative as both sides get to know each other in terms of comfort level.
A physician and a pharmacist working together to get the best outcome for the patient, using each of their skills to the maximum so that the patient does the best that they can.
I've worked with pharmacists for the 15 years I've been in this position, and actually I started even in my training as a resident. We had PharmDs where I trained as well, so it's been part of my training and practice for the last 15 to 20 years.
So it was never like a question like, should we have a PharmD? It was kind of like, we have PharmDs because they're essentials.
We work with pharmacists on a daily basis, and it's a great compliment to our patients. So we work with them in the context of having our patients see them, independent of any physician direct interactions, but also when we have our own private patients come in, to have pharmacists brought in to help with medication collaboration.
Retail pharmacists, I think there's less day-to-day interaction. There's certainly in and out, back and forth conversation about certain patients, but it's on a day-to-day basis. There's nothing consistent. We're very fortunate to have a clinical pharmacist in our office, so there's a lot more direct interaction with them.
When I first started working with pharmacists, it was during my residency so long ago, so I'm not quite sure I knew what role they played.
Some of the challenges when I started working with pharmacists was actually just knowing that they were there and using them as robustly as I use them now.
I think our biggest challenge is utilizing your abilities to the fullest extent possible. There's a lot more you can do. I mean, making medical decisions in that realm is helpful, but also being able to spend time with patients and counseling them and being part of the team. I think patients accept you as part of the team when they see that that's what we do, that's our culture.
I think it's probably more of a challenge for the pharmacist than for me, because I know what question I have and I bombard them with it and out of the blue, and sometimes they don't have the answer and I want them to have the answer. So I don't find it challenging on my end.
I think trust is an exceedingly important part of any provider-to-provider relationship. I think it's not unique to physician and pharmacist. It's physician and nurse, and it's physician and consultant, and it's physician to physician when you're working and your partners are covering your patients. So it's not unlike any other provider relationship.
I mean, it's really essential. If you don't trust a person's clinical judgment, then you can't really have a working relationship. So, but that goes with any part of the team.
I trust the pharmacists I work with now because I find them to be very knowledgeable, very reliable, amiable, and also they work with patients in an excellent manner, all of which are the keys to excellent patient care, in my opinion.
I think by seeing, if I send him a message, he follows through and lets me know that he's talked to the patient and the content of that. So just, getting the feedback about what's happened with my request has been important.
I have the luxury of being here almost every day, and so working alongside people, I can see things. I can see what I can see what their work ethic is like. I can see how conscientious they are. I can see how quickly they respond to messages. I can see how quickly they look up things, and their conscientiousness in terms of getting back to me about stuff, and their thoroughness. And especially when I listen to teaching or advice that PharmDs give about dose adjustments and stuff, then I kind of get an idea, am I agreeing with that? Am I feeling like that's the way I would manage it?
One would be availability, responsiveness, the feedback that I get from my patients. Hey, the pharmacist you had me work with was very, very nice, very, very helpful.
I think that is garnered over time.
Honestly, it's time. I mean, the longer I've been in practice, the more experience I have with what individual patients are experiencing at different pharmacies, and I also, you know, over time see patterns in, you know, the phone calls and the responses that we're getting, and so I know that there are some phenomenal pharmacists that we work with that I have built up a significant level of trust. I've called them on occasions, you know, about certain concerns or questions.
My expectation from pharmacy and the pharmacists that I work with is availability and accessibility, because it's hard to know which patient coming in the door will have medical needs that pertain to pharmacy, but also bringing in ideas and things with related to population health.
I expect them to be up to date on all the new guidelines that come out, because a lot of them, especially JNC 8 just came out, and the new cholesterol guidelines, etc. A lot of that has to do with medications, and if they're up to date with that, they're probably going to be more on top of it than I am.
I would expect that they would check back with me to make sure that what they feel is necessary would be something that I think would be a good thing to institute, so that we sort of we work together to come up with a plan rather than one of us arbitrarily do it.
We expect people to be honest with each other. I never expect people to know everything. I expect people to be looking stuff up, because I have to look stuff up all the time. So
to know the patients and to know our practice and know when it's appropriate to communicate and when communication is important.
I expect them to work really hard for patients and to really care about the patients and to be diligent about their care management in terms of what they're asked to do by the particular resident or a physician, and to follow up and to be conscientious and thorough about it.
Make yourself known, you know, schedule an appointment to sit down with them, talk about your background, your interests.
Well, I think there's nothing like a face-to-face introduction, okay, is to stop by. I think it would probably be best to be scheduled, stop by and say, hey, I'm in the community, this is where I work, this is what I think I can offer to your patients. Can you, is there something else, and then be open, is there something that you would want me to help out with?
I guess I would foresee that if somebody came and had a list of things that they could provide as far as services to the practice, that would be helpful. And I think for a busy physician, you know, a lot of the education services and monitoring services.
If I were to be working with a new pharmacist, either at my health center or in the community, I think just an introduction, whether it's physical or verbal, and delineating what your role would be in the context of the patient care for that day or that time is probably pretty important. Similarly, asking the physician or provider, what do you want from us? If our presence is here, what are the things that you're looking for?
I would go slowly, especially if it's a doctor who has never worked with a pharmacist. Don't expect to be managing all their anticoagulation patients or, you know, adjusting all diabetes medications. but you may be able to start with a slow process and then gain that trust that you asked about earlier, and I think that that would be the way to go.
I think some sort of communication, whether it's email or face-to-face, ultimately I think it'll come face-to-face because of that trust factor. You kind of have to know who you're dealing with. But I think there's going to have to be some agreement or discussion about what each person has to offer in the collaboration, because it's not just one way, it's both ways. So I really think there's got to be some sort of agreement and understanding on both parties about expectations and about what each person in the collaboration can offer the other person.